Welcome to Netsmart CareThreads, a podcast where human services and post-acute leaders across the healthcare continuum come together to discuss industry trends, challenges, and opportunities. Listen as we uncover real stories about how to innovate and improve the quality of care for the communities we serve. Let's get into the show.
Thank you for your time today. This is Jason Banks. I'm the Vice President of Client Development Post-Acute for Netsmart Technologies. And with me, I have Ernesto Lopez. Ernesto is the Chief Executive Officer for Hospice of Washington County. And again, Ernesto, thank you. I wanted to thank you for your time today. I can't imagine all that's on your plate with all going on in the country right now and the work that you and your team do at Hospice of Washington County and does every day on behalf of your community, patients at the end of life and the families that care for them. How's your team doing?
Hey, Jason, thanks for having me on. Absolutely. The team is doing well, despite all the challenges, as you described, that everyone is facing now through this pandemic. Our staff has really been resilient, and throughout the storm, they've remained focused on our mission and on providing the best possible end-of-life care to our patients and families. And so that's kind of been the driver in in this journey, is ensuring their passion for ensuring that patients are getting the services that they need in a time where those services have been restricted or they've been modified because of COVID-19.
Well, thank you again. I think, one of the many things that is top of mind for not just Netsmart, but for many throughout the country is on the teams that serve these end-of-life patients and families are doing. And one of the major concerns for a number of hospice and palliative care providers is not just the recruiting and onboarding of new team members, but it's really the retention and the engagement of these superheroes that are providing this care on a daily basis. How do you see the priority of that process, team member life cycle, from recruiting to onboarding to retention and engagement as a leader in this industry?
Jason, it's top priority for us because engagement is the fuel that propels organizational culture, and that organizational culture is what really impacts all those pieces or those phases of the cycle. You can't retain good people if they don't feel connected to the organization. And some organizations confuse an employee's engagement or connection to the mission or hospice in itself as a sign that the employee is highly engaged. And what we've found is that we have to, continuously connect with our staff, especially during this time. Communication is key because folks are working remotely now more than before. Folks are having a hard time sort of getting back to what we describe the mothership. There's always been that element of hospice where, your staff is out in the field taking care of patients and families, but they always have a place to come back and land. And that was the bridge of, maintaining connection, collegiality with other staff members and with their supervisors. And so that's changed significantly. So as we've made this transition, connecting those fibers of engagement are really key to ensuring that you don't lose your high performers, that you're able to recruit good people, and that you have a stable and highly engaged organization. And that's been a pretty significant shift for most hospices as they're going through this, last 7+ months of dealing through this pandemic.
It's almost like you were sort of reading my mind. I just got done with a book, You Win in the Locker Room First. It was partially written by Mike Smith, who used to coach the Atlanta Falcons. And and I think you used pretty much every word that he used to describe how do you engage with your team, which is culture and communication and connection with them. I mean, he talks about the 7 C's, and I think you almost said it verbatim. The one thing that we think about at Netsmart is, how can we play a role? Are there ways that you've seen technology play a role in either the satisfaction or dissatisfaction of the team and the engagement and the retention? And how do you see technology helping hospice and palliative care providers in the mission to serve those that serve others?
It plays such a key role, Jason, because at the end of the day, the most important elemental factor is it's got to work. If your technology isn't working consistently, then you're going to have people that are frustrated, people that are going to find workarounds, people that are going to be disengaged. And so technology has to work consistently, or if it does fail for whatever reason, how do we quickly rebound and get a solution to them so that they can continue to do what's most important. But from a pandemic perspective, technology has really been leveraged across our entire industry. So you're hearing everywhere about telehealth becoming, this new key tool or resource to be able to connect with patients and families better. Well, it's been around for a long time. Now it's really become more prominent, and organizations that really never considered telehealth as a viable tool are starting to understand the value, and I think that as time goes on, the use of these tools are going to be deeply integrated into future workflow, permanent future workflow, because healthcare providers have found tremendous value, time savings, efficiencies, and even effectiveness around using these tools, and they're modifying the way that they're providing care and connecting with patients and families. I would say the other piece is, being able to use technology to ensure that you're communicating to your folks internally. And so aside from ensuring that technology is working and that that it's functional, how do you communicate effectively and timely with your team internally if you're a email heavy user organization, or if you're using cell phones or telephones primarily to communicate, what other elements of technology can be used now, texting, video calling. We've started putting some different we've been testing different methods with our staff internally to see what's effective. But ultimately, it's all centered around communication, complete communication. How do we get information out to our people quickly so that they can respond? Or how can we get information out to people so that they know what's happening in the organization, so they're not worried about instability? They're not worried about, is my job, on the line? Is the organization going to be viable? Are we going to be able to serve our patients in the future? So all those pieces are critical in ensuring that not only do you have great care and you're continuously providing that care, but that you're also ensuring that you have different ways of connecting with your staff so that they feel secure in what we're doing and where we're going.
So good. I know that, it's sort of like languages. Some people prefer texting, some people prefer phone calls, others prefer email. So totally agree with that. It's funny, when I was serving in a hospice, a couple of were talking about using Skype for business, and boy, was that revolutionary at the time. But now, it's like everybody uses that, or Teams. So at Hospice of Washington County, the mission is embracing individual needs with love, kindness, and compassionate care while creating meaningful end-of-life experiences for our patients and families. And I know Ernesto is a servant leader and a humble leader, and so he would not mention on this, but I'm going to, that he himself is at one of their new locations waiting for the surveyor, which just shows the type of leader that he is. But what are some of the creative things that you've done or seen that enable your team to feel engaged, to feel appreciated, to stay connected to the mission and vision and the values of the organization?
Sure, Jason. I would say the first thing that our team did, was our leadership team, is to look at the things that we were doing before the pandemic that were really working well for us from an engagement perspective, and then try to ensure that those things continue to happen, even though we've got all these new restrictions and these constraints that are that make it more difficult to do it. So we wanted to take more time, more energy around these things that have worked really well for us. One of the things that we've done, and I'm sure many organizations do this, we handwrite birthday and anniversary cards to each of our employees every month. So the senior leadership team has done that for a few years, and it's well appreciated. We usually include a small nominal gift card in there and just a thank you and a happy birthday. Well, we've continued to do that. So each of our leaders takes the time, even though we're working remotely, they have to go in and handwrite these letters and these cards, and it gets circulated and it gets mailed out. And you would be surprised how many staff members, even though they've had this in years prior, I get a huge thank you. I can't believe you guys are still doing this. This is really neat. I appreciate it. And just the gesture in itself and the continued use of that gesture has been really impactful. They're grateful that despite these, logistical constraints and working remotely, that we're able to do this for them. I would say other things like everyone else, everyone's using Zoom meetings or Teams or whatever platform to make sure that they're communicating with their staff. But we've had our town hall meetings with all our staff on the Zoom call, which is really fantastic. We do daily operational huddles. We do daily department check-ins, and part of that is, especially all those elements, they're important because we have the confidence that the staff and the management team that they're doing what they're supposed to be doing to make sure that their areas are being moving forward, that the cogs are moving. But we do these check-ins not because we're trying to have some level of accountability or trying to ensure that people are working. No, we do them because it keeps us connected. It's those fibers of engagement that we talked about with the management team. We also have to have that, and so we make these sessions fun and creative. For example, my team would kill me if I shared this, but I'm going to share it anyway. We're supposed to have our leadership meeting next week, and so one of the leaders said, "Well, let's make a challenge. I want every leader to have a Halloween costume on their Zoom call, and we're going to have a contest to see who's got the best costume." And it's things like that they may seem insignificant. They may seem like, oh, that's kind of dorky. But it's one of those things that people rally around it and they get excited, and most people probably wouldn't even think about a costume or trying to. But this is where you see engagement really come through, because folks are now out of their normal sort of box of day-to-day work. Now we're having to modify to this new work environment. Well, why not make it fun? Why not make it engaging? And so that's one of the things that we're doing. About a month and a half ago, we started video blogs, and this has been really successful for us. So early in the year, I had one of my leaders that suggested, why don't we do a video? Why don't you do a video and send it out to the staff, once every couple of weeks, just to give up, organizational updates. In the past, I would send out, a sort of State of the Union email and with a lot of communication just to let them know where things were. And so, we finally decided to go down that road, and it's been a really neat experience because it's not just me sitting in front of a camera talking. We put a lot of humor and lightheartedness behind it. We do, we bring people on board. We make fun of things. I make fun of myself. It's one of those things that people have really connected with, and they look forward to it. So we try to mix a bit of humor and fun, but at the same time, we're communicating really important things. We're letting them know what's happening, what they need to do, what we're doing. And so it keeps them anchored into, hey, these are tough times. Folks are struggling around the country and around the world. And we've had to change a lot in our organization the last 6-8 months. But, we still have, the passion to do this work, and we still have a level of engagement to stay connected and to be able to, relate to each other in different ways. So that's been a really neat program. The other thing that I would share is we recently started an employee giving program which surprisingly, I know a lot of organizations do this already, but we've never had one before. We have a very successful development program. We have several different programs that we raise money for in our community. We've been very successful in our small community of raising significant dollars for our size population. And we've never done something for our employees. And so a few weeks ago, I went to our board of directors and I said, we have dollars that are allocated for, through our board for specific projects. And I made the recommendation that we would put these dollars or some of these dollars into a fund that would be used for staff that are going through medical or financial hardships. And so during this time, we've seen staff members have to be out of work because of health conditions unrelated to COVID, or having, difficult challenges because their spouse lost their job. It's been interesting for me to hear all these different stories, and as an employer, not be able to do something about it because we don't have a policy, because we don't have a process, because we don't have a program. This new program, which we call Hospice Gives, allows employees to donate their unused PTO time, because we have a lot of people that, that are not using their PTO because they've got nowhere to go. And so, they've decided to stay home and they want to continue to work. Well, they can donate into this fund. They can, payroll deduct small increments of money every month if they want to do that. And then we will use this fund to be able to, help those folks internally that are having these difficulties. And the reason I went to the board was because I wanted this program to be here in perpetuity, so that, in the next 10, 15, 20 years, our staff would sort of organically grow and align to this program. But I want it to be, I wanted it to be the staff's program. The board, allocated $50,000 to this program. I didn't share it with the staff because I want the staff to really be engaged and feel like it's their program. But those dollars will be there in perpetuity to help support this and get us off the ground. And I feel like these are the kind of things, the kind of programs that you do as an organization that really anchor staff to what they're doing, because what it sends the message is, hey, the organization cares for me. The organization is not just about the work. It's about my well-being. It's about my family. They care about me. They're willing to help bend and flex whenever I'm going through challenges. And, who doesn't want to work for a place that does that? And so I'm really proud of that program, and we're excited to get it launched and start using it, because we've got some folks on our team that really need that help.
So good and so true. I know I often tell people, if you knew the type of individuals that provide this care to folks at the end of life, they're really remarkable. But to have them come together and support each other in this kind of way is extraordinary through the Hospice Gives program. The one thing, you're going to have to send out some outtakes of the video blocks now, and you're going to have to send us some pictures of the Halloween costume get together. We're going to have to, in all seriousness, I do think that, a lot of times, while the majority of the population is now working from home, what they don't realize is that, you've got these selfless individuals that are out there in the community, continuing on to service these most vulnerable in their time of need. And so I think it really, doing things like that, obviously you have a great support system there with your own team, but it just sort of lets everybody see the type of individuals that actually choose this as their career and their passion. So I think that's just phenomenal. Love it. Finally, what do you see as the outlook? I know, we'd all like to have a crystal ball right about now. But what do you see as the outlook for hospice and palliative care over the next 6 to 12 months?
I think the outlook is good for us because for a couple of different reasons. I mean, we're seeing in healthcare the shift of acute, facility-based care to post-acute, community-based care has been talked about and debated for now. I can't even count the years, but it's always been it's coming, it's going to happen, it has to happen because our current process system from a healthcare perspective is not sustainable. Well, I think COVID has really forced us from a healthcare perspective to see that and see the value of home-based care. And the fact that, when areas around the country, especially places that ran out of hospital beds, or even in communities that basically closed down their beds because they wanted to make sure they would be available for an influx of COVID cases, the value of being able to refer patients out into the community for post-acute care became even more valuable. So I do believe over the next 6-12 months, we're going to start seeing more and more of this trend of patients that are starting to come back to the hospital for non-COVID related items, patients that we know need that kind of care, and getting those patients referred to the appropriate level of care, whether it's hospice or palliative care or home care or even, skilled nursing. There's definitely going to be a trend of an increase from the hospitals of these types of patients out to these service providers. But, as far as what I see for us internally, we've got to be able to adapt and pivot. And I think it's one of the things that we've struggled as an industry for a long time. The hospice industry is, sort of changing the way that we operate our businesses, the way that we do things, because we're so accustomed to sort of doing it within this box that, that was created when this wonderful benefit came to light, back in the 80s. A lot of programs struggle to change and pivot. And I think now we're going to be forced to change and pivot because we know that payer arrangements are starting to come to light. There's going to be a shift, with Medicare Advantage, and that's going to be a game changer for a lot of programs. But ultimately, the longer term view of how hospices are reimbursed and how we're engaged as a part of the continuum of care, I think are going to come more to light, and there's going to be a greater emphasis and focus for those providers that can do the things that the healthcare system needs: manage people at home safely, reduce the cost of care, and reduce the consumption of expensive care, which is has been the biggest challenge within healthcare for many years now. So I think the outlook is good for our industry, but we've got to be very flexible, and we have to start taking more accountability for some of these patients that aren't getting to us, aren't getting to palliative care, aren't getting to hospice, but are sort of floating around in that cycle of acute, post-acute care back and forth. And so this journey or this experience of COVID-19 has forced us to look at that and see how prominent and how valuable providers like hospice and palliative care can be to the system.
Well, I couldn't agree more. Yeah.
The other thing that I would say that's going to be important and going to be a challenge for us in our industry is workforce health, and ensuring that our staff is staying healthy and protected from COVID-19. I think a lot of people don't realize that we focus on the hospitals and the staff that it's well documented, the horrific outcomes that occurred early on in the pandemic, where many healthcare providers lost their lives because of COVID-19 or became sick. And these are in controlled environments. And so you think about hospice and palliative care, you have people that are going into someone's home, going into environments that aren't protected, that aren't confined. You have an environment where you may have several family members, young, middle-aged, older, and you don't know if someone's infected in that home. Our staff are going into those environments, and they don't have the types of protection hospital intensive care unit nurse may have. And so there's a tremendous amount of risk involved in this kind of work. So, programs have to be very diligent, that they're screening, that they're making sure that their staff is staying healthy, that they're reporting symptoms back to, the organization, so that we can help manage and ensure that we're not sending someone that's potentially sick into an environment where they're healthy patients and families.
Yeah, I couldn't agree more. I think the industry has been in some aspects overlooked in terms of protecting the team members that are putting not only their health, but quite frankly, their family's health in harm's way on a daily basis. I think that, I know we've all been appreciative and in awe of what your team does, but I so appreciate now more than ever what hospice and palliative care is. I couldn't imagine actually serving in a hospice now with sort of the short durations, unfortunate and tragic durations of the end of life with some of these COVID-19 patients. And so, as we all know, and I know most of the listeners know, that the most intensive time for hospice is when that patient and family come on service, and then obviously when that patient or family, the patient is deceased. So, and that has had to put a tremendous amount of pressure on you, your team, and the industry as a whole. And I just appreciate so much, not just your time today, but you and your team and the rest of the hospice and palliative care organizations around the country serving those that are really, truly the most vulnerable at this time. So thank you again for your time, and we look forward to connecting again.
My pleasure, Jason. It was a pleasure sharing our thoughts, and thank you for your compliments. And again, I wish you and your family as well safety, and continue to do what you're doing on your end with Netsmart, because we appreciate having those resources so that we can take better care of our patients and families. So thank you.
Thank you, Ernesto.
At Netsmart, we understand the challenges facing provider organizations. Our team will help you navigate changing value-based care models with solutions and services that make person-centered care a reality. We'll equip you with technology and services that provide holistic, real-time views of care histories that inform better decision-making and better outcomes. Visit us today at ntst.com. Netsmart, serving you so you can serve others. Thanks for listening to the Netsmart CareThreads podcast. Through collaboration and conversation, we can work together to make healthcare more connected than ever before and better support the communities we serve. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time.